for folks who do have a trauma history. And there's actually some very nice evidence showing that mindfulness might actually be more effective for people who had early life adversity, like exposure to abuse, for example, because it can potentially help heal the past and the present moment. But sometimes we need to do these adaptations to be trauma sensitive. And for the adaptations, like at Brown, we have an MBSR teacher training program, and I know you're part of the Global Mindfulness Collaborative that has a well-respected MBSR teacher training program as well. So at Brown, for example, we've just started this new course called the Ethos of Mindfulness-Based Stress Reduction, and we do a deeper level of training on trauma sensitivity, for example, as well as the science of it, the contemplative underpinnings, and diversity, equity, inclusion, and belonging, so that we're adapting it to, say, in the case what you were just sharing, to be trauma sensitive, so that, say, in the past, we might have a meditation on the breath, but for someone who's had some trauma around their breath, whether it's asthma or other things, the breath might not actually be a safe place to have an anchor point. So best practices around that are to offer other anchor points, other objects of meditation, like, part of the body, like, say, the palms of the hands or the soles of the feet, and just being there with the raw sensations of it, of warmth, coolness, moisture, dryness, touch, lack of touch. Or even if the body's not a place of comfort, as a meditation object, to even use, say, sound or the lack of sound. And it's those raw elements of sound, like the pitch, volume, if it's regular, irregular, how close or far it is. So that's sort of an example of trauma sensitivity that maybe even for folks who do have a trauma history. And there's actually some very nice evidence showing that mindfulness might actually be more effective for people who had early life adversity, like exposure to abuse, for example, because it can potentially help heal the past and the present moment. But sometimes we need to do these adaptations to be trauma sensitive. And there's a book by David Treleaven called Trauma Sensitive Mindfulness that's a very skillful way of presenting some of this work, if anyone's interested in that.
Yes. So adaptations, as you said that, just remind me of, the older tradition, very firm traditions where just sit and don't move. Like that's all you do. That's some of the, when I began my journey, that was more of my experience. And
Mhm.
it was a struggle. It was a struggle. There were no, in MBSR, there's options. You can lie down, you can sit, you can stand, listen to your body. And I did a lot of retreats way back where just sit.
Yeah.
If your knees are shaking with pain, just observe, right?
Right.
And, just observe.
Yeah.
So
Yeah. And if you're coming into that without a huge foundation and the teachers are not so available to support, how's that going to go in terms of risk of adverse events, for example? So decent amount of research going on in adverse events of meditation right now and mindfulness, and at least what I'm seeing, at least with some of our work, MBSR, every single intervention can have adverse events, whether it's a surgery or a behavioral intervention or medication, like even just Tylenol. Look at the
yes.
list of potential adverse events on a Tylenol package. And so with mindfulness based stress reduction can certainly have things that can arise. But I do find, especially increasingly as it becomes more trauma sensitive and it follows the evidence on that around adaptations, that it can really lower the risk of adverse events. And it, compared to, say, a retreat that's really pushing hard on some of the things, just like you shared, if you just kind of go in without a strong foundation, it can actually crack people open in really amazing ways, and huge
Yes.
insights can arise. It's like sort of it can be a fast route, but it's like a higher risk
Very high
in terms
risk.
of like things that you know might not go as well as you hope.
Yeah.
And so that's something that we're trying to do, including at Brown, is to study adverse events really carefully, so that as we develop evidence-informed programs that were maximizing the benefit, minimizing potential harm, and also just being transparent about that so that everyone has informed consent about what they're getting into. And same with MBSR.
Mm.
When we have the information session, that's part of the script for the
Right.
information session, is just to share about potential benefits and also potential difficult things that can arise too, so that people just have a um, you know knowledge of what they're getting into. And overall, it tends to show predominantly positive benefits at the population level, but things can arise. So we always want to be really respectful to everyone, and to do the research to see what is arising, and to report that, and to minimize the likelihood of that as much as we
Yeah.
can through our teacher training programs and offering the MBSR itself.
Mm. This deep root of research in, uh, we began, I think, at UMass, University of Massachusetts Medical School, Bianca Badzin, mindfulness-based stress reduction.
Mm-hmm.
Really, it's one of the things that actually kind of hooked me to this mindfulness. It's like, wait a minute, it doesn't just feel good, even though it has challenges, it's not easy, mind is everywhere, things come up. But actually, it's quite rooted. And that was quite remarkable what John did from the start as a scientist. Just let's keep track of what difference is this making in terms of evidence based.